Hello everyone, this is Dr. Shavanti Reddy, fertility specialist and gynecologist at Shubha Fertility. So the topic for today's discussion is how does PCOS affect the egg health and how does it affect the IVF cycle. So before going to the PCOS and how does it affect the egg health, I want to discuss what is PCOS at first. So PCOS is Polycystic Ovarian Syndrome. It is generally very commonly seen around 30 to 40% in infertile couples. So how does it characterize and how do you diagnose PCOS? It is generally categorized. The symptoms range from irregular menstrual cycles and you find hyperandrogenemia, that is increased androgens, male hormones like testosterone and DHEAs. And also you see polycystic ovarian morphology when you see on ultrasound, that is more number of follicles in both the ovaries, more than 20 follicles per ovary is seen. This is the generally what we see in PCOS, and the symptoms are like we see regular menstrual cycles as already discussed. We also see infertility in patients because they have irregular cycles, oligomenorrhea where they have less than 8 cycles per year, which might lead to anovulation, and definitely it affects fertility. Next symptoms we see is weight gain because it is associated with insulin resistance, and also we see dark patches in the neck and underarms, and many other symptoms and high risk factors are also associated with PCOS. So how does PCOS affect the quality of the egg? So before going to that, we need to discuss how do you define the quality of the egg. So it is basically depending upon the factors of how the egg gets matured. Egg needs to fertilize and then become an embryo. So the ability of the egg to get matured and to get fertilized and to become a successful embryo and then successful pregnancy will define the quality of the egg. So these things are generally determined by the proper follicular growth in the ovary. So what happens in PCOS is there is aberrant folliculogenesis, there is a disrupted folliculogenesis, so which leads to poor quality of the egg and thereby giving the abnormal follicular growth and abnormal oocyte, and there is no maturity of the follicle, and there is no ovulation, and that might lead to no embryo or thereby no pregnancy. So the whole follicular genesis is affected in PCOS. This is basically in PCOS what happens is there is intra-ovarian hyperandrogenism and also hyperinsulinemia due to insulin resistance. So what happens in the body, in the female body in PCOS is they have insulin resistance, body starts producing more insulin, which leads to hyperinsulinemia. So what happens in hyperinsulinemia? Again, it affects the ovary, causing anovulation. It leads to anovulatory infertility. So thereby what happens, the follicle doesn't get matured and they have multiple immature follicles which looks in the ovary as small cysts. Thereby the name comes as polycystic ovaries. So this is what happens in PCOS. It ultimately affects the quality of the egg. And what happens, the other condition is chronic inflammation. PCOS is a chronic inflammatory condition. It is in a pro-inflammatory state. So there is a oxidative stress going on. So this will again cause cellular damage and leading to oocyte damage. So these are the reasons which we see in PCOS causing the quality of the egg. There are many evidences stating that PCOS is affecting the quality of the egg, but there is no major conclusive evidence found in many studies also. And how do we deal with it, and how when we go for IVF, what are the things we do in PCOS? When do we opt for IVF in PCOS is the next question. So what happens is in PCOS, if you're left untreated, like if you're left untreated, the PCOS will definitely turn into, the people who are trying for pregnancy, they'll suffer from infertility. So when they try ovulation induction time intercourse, if they're not conceiving, they can they'll try IUI. So when they opt for IVF, after a long period of treatment with ovulation induction time intercourse and IUI, the next option will be IVF for them. In IVF, we have a chance for taking off the eggs and selecting the best quality of the egg and fertilizing it with the sperm and to make a good embryo and transfer it into the uterus. In patients with PCOS, we tend to have lesser dosage of drugs to the patient because there are many number of follicles, the chance of producing more number of eggs. So we start with a lower dosage because it leads to hyperstimulation. There is one risk of ovarian hyperstimulation syndrome in PCOS. So lesser dosage of drugs are required for patients with PCOS who are going for IVF, and we do a very controlled ovarian stimulation to avoid OHSS. And how do we prepare when you go we're preparing for IVF in the patients with PCOS is we always tell them to have a lifestyle modification, because the first line of treatment is always lifestyle modification in PCOS. Get a better diet, avoid all the bad food, eliminate all the bad food from your diet, like white flour, white sugars, and all the bad food which you eat out, so like the burgers, pastries, pastas and pizzas. All that has to go from your diet. Take a well balanced nutrition, and if your BMI is more than 25, try to reduce at least 5 to 10% of your body weight with some amount of exercise. Add into your daily routine. What we advise is at least 150 minutes per week of activity, physical activity from 8 to 45 age group. That is what we advise. A moderate physical activity is recommended. If you can do at least 75 minutes per week of intense physical activity, that is also very much better. At least try to reduce around 5 to 10% of your body weight, so that it will help in increasing the conception rates, increasing the ovulation rates, and better success in even in IVF rates. So lifestyle modification is very primary, and just change your diet and come into a workout routine before going to IVF. Add a nice and we'll start with some antioxidants with some ionosterone in it, and we'll also tell them to have a better lifestyle and prepare yourself for IVF. These 3 months will be the motive just before going for IVF. Thank you.